Hi, friends. This is Dr. Ravi Kamapalai. I'm an infectious disease, wound care, and obesity medicine specialist in Georgia. I'm going to talk on use of low carb in diabetic medication, deprescription in a complex wound care scenario. And I'm located in Georgia, as I told earlier. And my disclosure is nothing but removing barriers to healing to these three specialties that I work on. And my Twitter handle is @woundphysician. I'm a part of a founding member of Indian Podiatry Association in 2008 when we started this association to promote wound care and podiatry care along with leaders in India who are into wound care, including Dr. Suri, Dr. Saxena, Dr. Jangam, and multiple other leaders in wound care. And we have been successful in promoting wound care across almost 17 states of India. And on October 8, 2022, we are celebrating International Podiatry Day. This is a case of a 47-year-old male who is diabetic, hypertensive with mixed hyperlipidemia, and had a history of coronary disease and bypass surgery in 2020, and has been on diabetic medications, including Novolog and Ozempic, which almost 34 units BID of Novolog. And in April 2022, he developed a diabetic foot ulcer. He used to be a smoker in the past, ended up having failure of the skin grafts that were done. And MRI of the foot showed osteomyelitis, and he presented to see us around 7/19/2022, basically July 19, 2022, started on IV antibiotic therapy for polymicrobial infection of the foot. And he was given piperacillin tazobactam, and he also ended up having angioplasty done and to left posterior tibial artery, and ended up initially refusing amputation, and because of the significant bone infection and non-salvageability of the toe. Though we pride in preventing amputation, it was thought that it was an appropriate thing to save the foot from further worsening. And during this course, also we discussed with him about his overall metabolic health. He went on to do low carb. His creatinine improved, and also he lost around 25 pounds, and his waist circumference improved by 11 inches. And basically, this was his presentation. And if you see, there is a necrosis of the distal tip of the toe, and we started and continued and followed up with antibiotic therapy and local wound care. And slowly but steadily, if you see, the bones started exposing, and it was hard to heal that area. And ended up finally convincing him on amputation of the toe, which ended up being done. And finally, we were also able to do a body composition testing after the wound had healed. And he only has excess of 17 pounds of fat right now, but essentially he lost a lot of weight. We were not able to do this body composition analysis earlier, but now that he's off medications, and he's really feeling better. Now, how did we do that? Is by using continuous glucose monitoring and also food tracking, where if he posted like this potato and the rest, we used to give him a feedback. And also using continuous glucose monitoring, he targeted his blood sugars and slightly got better. And he went off medications, including 70/30, and also Ozempic. He said that he was getting hypoglycemia with that, so he stopped doing it. And as you can see here, his creatinine also improved over time to 1.4. And I wish he is able to tolerate medications, but he does not want to do medications. He wants to figure out how to do this better by a nutritional approach. And we are going to continue to work with him now that his foot is healed. Now, this is a quick interview with him.
So, Mr. Gorman, how are you today?
I'm good. How are you?
Thank you for coming. So that I just wanted to talk to you a few things about your journey, and trying to understand how this whole thing happened. How did you end up having your problems with the foot? How long have you been diabetic?
I've been diabetic for over 30 something years.
30 years. So, and then you are 47 years old now.
Yes.
So basically in your 20s, huh?
Yes, in my 20s, yes. I've been diabetic since my late 20s.
Late 20s. And how about, when did they start insulin on you?
30 years ago.
So, around the same time. So, and then, so have you gained a lot of weight?
I did, yes.
Okay.
I did gain a lot of weight.
Okay. And then, how come you ended up having problems with your health? What did you think your problems with your health were before you came to me?
I didn't think I had any problems.
You did not think you had any problems. You said you're doing fine and dandy.
Yeah. Till my toe decided to.
And when did your toe problem happen?
It happened in April. And I went to the doctor and we tried several things to get the toe to start healing.
Okay.
But it did not work.
Okay.
So he figured it was probably a bone infection.
Okay.
So we did several things, and then he sent me to you, and you talked with the doctor and everything, and we started antibiotics.
Yeah. So basically, in April you had it, and you came to see us on July 19th, and obviously you had bad toe infection with osteomyelitis, and initially you did not want the toe amputation done, so we tried to save it, but we ended up losing the toe, but ended up healing it completely. And now the journey, what did you uniquely do different during from say July 19th till October 4th? Today is October 4th, 2022.
I stopped eating carbohydrates and started having a new diet.
Yeah.
Once I started a new diet, then I changed my mindset on how I eat.
Okay.
Once I did that, then everything started coming down and going off.
So like how many days did it take for you to come off your insulin? So
I say probably maybe about a week or two.
How much insulin were you taking?
Almost 72 units.
72 units, 36 in the morning, 36 in the evening of Nolan.
Yes.
And then how did you do that? How did we guide you on that? Like you had a continuous glucose monitor?
Yes, I had a continuous glucose monitor, yes.
And then so when you came in, if I remember well, your weight was 234 pounds. And this is the first body composition testing that we did today. The reason we had to wait till now is because your toe was not completely healed, and we could not contaminate the machine. That's why we could not do it. So your weight on 200 is now today is almost 208 pounds, which is you lost 25 pounds of weight. And your waist circumference initially, that's what we do normally, it was 54 and has come down to 43. So your waist circumference has gone down 11 inches. Your BMI went down from 34.6 to 30.8. And you only have 17 pounds of excess fat right now. And obviously, diabetic since the age of 20s, in mid-20s till now, and insulin, all the 70-30 insulin, you lost it. And then, so what is your goal? What is your goal?
My goal is to finish up with my body mass completely gone, of my weight, and to be completely healthy for the rest of my life.
Yeah. So how do you plan to do it?
With the mindset of my eating and staying in exercise and everything.
So basically we have to build the muscle mass, right, monitor the sugar, and make sure that we exercise and make sure that you don't... See, remember, this is a dietary lifestyle. You go back, do the same thing, you come back again. And the goal is keep your toes on your feet and your limbs on your body, and make sure that you don't have heart problems and all the metabolic complications. Thank you for trusting us, and make sure you keep follow up, okay? Thank you very much.